I'm Oscar Oeding. I'm an orthopedic surgeon here in San Jose, Costa Rica. I'm originally not from Costa Rica. I'm originally from Colombia, and I studied general medicine there. And since then, I wanted to be an orthopedic surgeon. Maybe basically because I think that's the field in medicine where we can reach as close as possible to really cure the patient. I mean, my patients come to my office with some pathology, and after we finish the treatment, they usually get relief of that pathology and had a second chance in life. That's the reason why I choose implant surgery or joint replacement surgeries, because of that, basically. Always the healthcare level has been very high in Costa Rica, because we have the chance to use whatever we need in our patients, and that allows us to maintain a very high level of practice and a very high scientific level also. I started this medical tourist system about 12 years ago. I was the first orthopedic surgeon to build the system here in Costa Rica, and I have quite a good experience with my patients. I don't offer everything that I can do. I only offer the surgeries that I know that can be recovered back at home without much care. So I think that we have developed quite a good system to offer a good quality of surgery with a very, very good rehab and endpoint at home in the United States or wherever they are. That's incredible. I mean, I receive emails almost every week from my patients telling me that, "Hey doctor, I was able to get into the car without having pain in my hip." Or, "Hey doctor, I was able to cook a dinner for my family without having to rest every 15 minutes or take a seat every 15 minutes. Or people that are able to go back to work because they have a second chance in life with this type of surgeries. Not really. I mean, I spend at least 4 weeks a year in the United States trying to keep updated in courses, microfellows, meetings, and we use the same type of implants they use there. We use FDA approved implants, most of them brands from the United States, like for example in joint replacement, Biomed, Smith & Nephew, Depuy, Zimmer, which are basically brands that are from the United States, and that's the same they use there. The patient has to be very sure about the expectation he has for his surgery. For example, I receive sometimes patients from the United States that has not the proper expectations about their surgeries, and they think that they are going to get, for example, a bionic knee, not a knee implant. So I think that maybe talking very clearly to my patients and explaining them what to expect after the surgery is the best way to avoid complications and to have long-term good results. Most of them, they travel with all the instructions they need to complete their full recovery. But in some cases, we need to make a short follow-up with them through email, asking them to send me pictures about their knees, their hips, or sending him some specific instructions to the proper muscular recovery, to do exercises at home, sending them videos about it, and sometimes even sending them medical reports for their doctors back in the States so their doctors can help them too. Welcome to paradise whenever you need to come down here.